The UK government has just updated the information on the health and care worker page. I'm going to concentrate on switching to this particular visa. There are many questions that needs to be answered. Can students switch to a care worker visa with 6135 and 6136? Can you bring dependents? What occupations are eligible for this health and care visa? What is the minimum salary threshold? These and many other questions will be answered in this video. It is important to note that the health and care worker visa is for medical professionals such as doctors, nurses, health professionals, or adult social care professionals, and both you and your dependents do not need to pay IHS fees. Let's check out switch to this visa. It says you might be able to change or switch to a health and care worker visa if you're already in the UK on a different type of visa. Your partner or child's visa will not automatically switch to this visa if you switch yours. If you do not switch their visa, it will be valid until the original end date. This answers your question if you've been worried whether you should switch your dependent's visa when they are still valid. It shouldn't be a problem if the sponsor's license is still intact, that has not been revoked. They can either apply at the same time as you or at any time before their current visa expires. Let's look at the eligibility. You must meet the following requirements: that your job meets the eligibility requirements and you can speak, write, read, and understand English. So how can you switch from a student visa to a health and care worker visa? Now it says that if you're currently in the UK on a student visa, you must also meet one of the following. You have completed the course you were sponsored to study. Remember to look at the date on your CAS letter. Now, your job start date is after your course has finished. The university will send you a letter congratulating that you've passed, and they'll send your name to the Home Office. And then it says that you are studying for a PhD full-time and have been for at least 24 months, which means that you can only switch when you are pursuing a PhD after 24 months of study. Here comes the key criteria for those students who want to switch to a care worker or a senior care worker visa. Now, you must have been working legally in your job for your sponsor for at least 3 months. Please tell people to stop telling others that they cannot switch from a student visa to a care worker visa. It's written clearly here on the government website. Make sure that the 3 months of work experience is before the date assigned on your COS. Kindly note that those people who cannot apply to switch to this visa include those on the visit visa, short-term student visa, parent or child student visa, on a seasonal worker visa, domestic work in a private household. It says that you must leave the UK and then submit an application from abroad, but we all know that 6135 and 6136 can no longer come into the UK from abroad from the 22nd of July 2025. Standard application fee cost £304 per person for up to 3 years and £590 per person for more than 3 years. When switching to this visa, just be prepared to provide bank statement, pay slips, or any other thing that they might tell you to do so when you have completing this form. But note that you can provide your identity and supporting documents, and you can do this through the UK Immigration ID Check app to scan your identity documents and anything they ask you to provide, or you can go to the UK Visa and Citizenship Application Services. I think it's the biometric appointment. You can do that, but they'll tell you which one you need to do when you apply. Kindly note that you must apply online before your current visa expires. When applying for a skilled worker visa, you'll be asked if you are applying for a health and care worker visa as part of your application. Make sure you choose yes, because you know that the health and care worker visa is under the skilled worker visa. Once you've started your application, you can save your form and complete it later. After submitting your application, you can get a decision within 3 weeks. You might experience a delay if your supporting documents needs to be verified, you need to attend an interview, or because of some personal circumstances. So prepare yourself for that. You can also decide to pay for faster decision. Come on guys, let's check the jobs that are eligible for this particular visa. Identify the 4-digit occupation code by asking your employer or using this Cascot occupation coding tool. Now here are the occupations eligible for the health and care worker visa. Just go through them, identify the code, and then submit an application. It should be on your COS. The code and the name of the job role should be on your COS. As you can see, these are the high skilled ones that they have listed here. However, if you are extending, updating, you're switching a health and care worker visa, your job can also be in one of the following medium skilled occupation codes: 6135 and 6136. They are repeating the same thing again, that if you are switching from a different visa to these two codes mentioned here, you must have been working legally in your job for your sponsor for at least 3 months. So it does not apply to other occupation codes. You mustn't work for your employer as a nurse or a doctor or any other codes mentioned previously. They now mentioned occupations that you can only extend, but you cannot apply for the first time. It says if you are extending or updating your visa and you got your certificate of sponsorship before the 22nd of July 2025, your job can also be in one of the following medium skilled occupation codes. For example, we have your healthcare practice manager, medical and dental technicians, health associated professionals not elsewhere classified, nursing auxiliaries and assistants, ambulance staff, dental nurses. Please note that they made a mistake here. Nursing auxiliaries and assistants can actually apply for the first time because it's on the immigration salary list. It's saying that you must have continually held one or more health and care worker visas or skilled worker visas since you got your certificate of sponsorship. Anyway, let's move on to approved UK health and care sector employers, that you must have a job offer from an approved UK employer before you apply for a health and care worker visa. This is a reminder that they are called sponsors, and this job offer might come from the NHS, an organization providing medical services for the NHS. It could be an organization providing adult social care services. Just note that your employer must be registered with the CQC, and you can check whether your employer is registered on this list. Now, it says that if you already have a job offer from an approved employer, then they will give you a COS. A COS is a certificate of sponsorship, is an electronic record, not a physical document, and it will have a reference number which you will need for your visa application. Many people have received a 10-year ban because they were given a COS that was assigned to someone else. Please avoid trouble. Note that your COS is valid for 3 months, so you need to submit an application, visa application, within that period. Let's discuss salary requirement. You need to be paid at least £25,000. Your going rates, compare that with the £25,000 to know which one is higher. That is what you need to be paid. Note that different occupations have different going rates, so you need to check it. Click on the link down here. But let's go to documents that you need to submit this particular application. It says here that you need a certificate of sponsorship with reference number, proof of your knowledge of English, which you can get with IELTS or UK NRIC if you have a degree from outside the UK. For some high-skilled medical professionals, you need an IELTS result, so just prepare yourself for that. A valid passport, your job title and annual salary, your job occupation code, the name of your employer and their sponsor license number. This will be on your certificate of sponsorship. Other documents you might need, depending on your circumstances, you might provide evidence that you have enough personal savings to support yourself in the UK if you're coming from abroad, and if you've not spent up to 12 months in the UK. Next is proof of your relationship with your partner or children if you are applying with them. Now, we also need tuberculosis results if you're coming from certain countries. You can check the list of countries there. A criminal record certificate if you're working in certain jobs. You know that care worker needs that seriously. Now, we also have your UK PhD certificate or unique ECCTIS reference number. If your qualification is from outside the UK, you will need to apply through ECCTIS. If your occupation doesn't fall under this list here, therefore you need to provide a criminal record certificate when you submit an application, especially if you're submitting from abroad. So prepare yourself for that. As stated earlier, you can only bring your dependents into the UK if you are applied before the 11th of March 2024. One of the following must be true. That's you're currently still on the health and care worker visa, you're extending, you're changing a new job, or you're applying for a child born in the UK. Now, this is the one that is new. If your occupation is listed as a medium skilled, you can only bring your dependents if you are submitting before the 22nd of July 2025. One of the following must be true. You are currently still on a health and care worker visa, you're extending your health and care worker visa, you're changing your new job, or you're applying for a child born in the UK. If you're the only living parent responsible for the child, or your child's other parent is also sponsored on a job listed on a medium scale, you can only apply for permission for your child to stay in the UK. I hope you've benefited a lot from this video. Please like, share, subscribe. Please share this video with your family and friends. Many people would not understand this. I hope it has put all your questions to rest. You now fully understand what you need to do to get health and care worker visa. I'll see you in my next video. Bye.